Hi, this is Kendra Neilsen Myles. I am a certified health education specialist and yoga instructor, and this is the Restored Wellness Podcast. Restored Wellness is a podcast that brings you information and resources for restoring function, hope, and patient empowerment. Our focus is on chronic pain, fatigue, and other chronic, often invisible medical conditions. We have a specific interest in hypermobility disorders and related conditions, movement, nutrition, and mind-body strategies for living well. Thank you for tuning in. We're here for the third episode of the Restored Wellness Podcast, and I have Dr. Linda Bluestein with me today again after our awesome episode last time with Dr. Jyothi Rao of the Shakti Health and Wellness Center. And I know I love her. I love her as a person. I love her as a provider. But I know that was one of the first times that you've been able to speak with her from a business and personal level. We were really talking about the business side of practicing integrative functional medicine, and she's a wealth of information. And do you have any thoughts leading up or thoughts after the last episode that you would like to share?
Well, but the time-consuming nature of treating the whole patient, I think, is really the key. That in order to get to know someone, it takes time, and I don't think there's any substitute for that. So I think that any business model needs to factor that into consideration. And you can have the best staff in the world, but it really does require time to develop that rapport and the education that is necessary to relay to the patient so that they can understand why it's as important as it is to make the lifestyle changes that they need in order to improve their health. These things are hard to do. They're very hard to do. So I think people really need to understand, and they can be much more motivated, and it can really help them to stick with it because they can understand, well, oh, this is why I'm doing this. Whereas otherwise, if it's just, you need to change your diet in this way and eliminate these foods, but add in these foods, if they don't understand why they're doing that, then it's really hard to stick with the program.
Well, I know I have always so many questions that I always want to ask that I think about, not just from a patient side, from a business standpoint. And I know it's challenging to go out on your own like you all have done, and Dr. Rao's been doing it for a little bit longer, and you just opened your practice in December. And we talked a lot about the medical system and that it needs to change, and will it change? I think personally it has to. There's more and more providers trying to find some other way to practice or have different assets or resources in their practice that allow them to practice more integrative, whether it's integrative or functional. There's obviously clearly a need. Life expectancy rate dropped for the second year in a row. We were discussing the issues that we have as a medical, from the medical standpoint, from the healthcare structure that we are currently in. But it's not just that there's things that are broken, but there's also issues that humans are facing. We are facing the fact that our life expectancy is decreased the last 2 years. We have issues with women after they've had babies. We have the highest rate of maternal death after they've delivered. There's something clearly going on, and it's not just the fact clearly things that are not working. And we talked a lot about integrative and functional, what the difference are. I think there's a lot of overlaps, but there's clearly something that we're looking for, and a lot of providers are looking for, not just you and Dr. Rao. There's clearly something that patients are looking for, but there's still a challenge. And so we talked about the business side of that, and will it change? And what are the biggest barriers that you all face from a business standpoint, not just from the fact that you have to fee for service, but also professionally? Do you have anything that you would like to add to that before we move on?
I would. I think that one of the biggest struggles, and Dr. Rao definitely alluded to this, that people have a hard time making that investment in their own health. And I think that the challenge is, and you might know that is something that you are doing that is prophylactic. It's going to help you in the future. You don't absolutely have to do it, but if you want, especially around here, I live in Wisconsin, if you want to be driving safely in the winter, you need to have good tires on your car. So they might do something that is a little bit more preventative and spend the money there. Whereas I think that it feels a little bit more like a luxury, or maybe a little bit more nebulous to people, especially if they're used to going within the insurance model. And it's very challenging to view that this might be something that would be worthwhile to spend money outside of your insurance plan when you've already spent a lot of money for your insurance plan. I understand that. I definitely understand why that's so challenging. And it's not a concrete thing that you can quantify and say, I for sure I'm going to get something out of this. I think that that's Those are all really challenging, but not uncommon for families to be able to make that investment for their children or other loved ones, but they have a harder time maybe doing that for themselves, which is unfortunate, because if you don't have your health, you don't have anything. And so I don't think there's anything more important than our health, and it is worth the money, but it's hard to wrap your brain around that, and it's hard to understand why it is as expensive as it is. But it is, even when you are delivering healthcare outside of the insurance model, it's still very expensive to do. And by the time you pay for all the insurance and everything, it's something that is very time consuming, and but it's definitely something that's growing, the non-insurance providers.
Well, and there's also clearly a need that patients realize integrative health. And what I mean by that is different modalities. There isn't just one pill or one method that is going to help people feel better. It's definitely a recipe. It's a lifestyle. It's a overall environment. There's so many different factors that go into our health. And in a lot of ways, these therapies and these approaches are band-aids to what we aren't doing as humans anymore. We've taken ourselves away from nature. We are inside all the time. And back in the day, whether it's hunter and gatherers or whatever you want to look at it, people didn't have to worry about whether they exercised or where they got their nutrition, because it was part of their life. It was what they did all day long, and they didn't have to think about it. But now we've removed ourselves from nature and basically the way that, whether you're God or evolution, developed us to be. And we were meant to, eat off our land. We were meant to walk all the time. Now we are dealing with the issues that we are seeing, not saying that's solely the issue, but there's so many more factors that go into our health and wellness than just one therapy or one approach. And a lot of times, by the time patients have been down the gamut and then some, and spent a lot of money all different ways for tests that are not necessary, or surgeries or whatever it is, and they still don't feel very well, they find a recipe that works best for them. And it might be a little bit of this and a little bit of that. And a lot of times it's not just diet and exercise. It's making sure you laugh. It's making sure that you're spiritually satisfied in whatever that way may be. It's relationships. It's being outside of the labels and not being totally consumed with that. It's making sure that you have a life outside of illnesses. It makes sure that you have a title outside of, and knowing who you are. It means that you're enjoying your children and you have some kind of approach and way to focus your brain on something, to this mind-body approach. Our mind is integrated with our bodies and vice versa. And it's funny that we've really separated that in the medical system for so long, and yet it seems so simple. So something has to change. Patients are looking for it, and it's most certainly a recipe. And those providers that are like you and Dr. Rao, that are working with us to learn with us and saying, look, I don't have all the answers, but I'm willing to help you and walk that journey with you, so that we can find the best way for you to feel better, and what might be really, adding to how you feel. But you also have to do the work at home. What about business-wise? We talked about the barriers that you face being fee-for-service, but what about professionally? What do you think the biggest barriers are from a medical perspective when you do, and you go out on your own and your fee-for-service model and you're doing integrative functional medicine? What is the barriers that you see from a professional standpoint?
It can be very challenging. And for me, I have patients that come from pretty considerable distances to come see me. And so they need referrals to providers that are more local for them. And because I see people from so many different areas, it can be really hard to develop that network. And, if it was all a local population, then I could develop a network of, psychologists and psychiatrists and physical therapists and occupational therapists and, all of these different, acupuncturists and all of the different types of providers that I would like to have, and never mind all of the medical specialties. And even just, it's so important for each patient to have a really, really good primary care physician. And I get asked all the time, when you live, a full day's drive from me, usually I don't, unfortunately. So that can be very, very challenging from a business perspective. And those things are very important for patients to be able to get well as quickly as they can. They need kind of a whole multidisciplinary approach. And so that can be hard when you're not part of a system. You know, if you're part of Mayo Clinic, then of course people come from all over and they're seeing a bunch of different providers on that same day. But these people come and see me, and then they're going back to their own hometown. And you know, if I want them to see someone for occupational therapy, for example,